I know that for 20 years I've been going to conferences, and every time we go to a conference, you go in, you sit down, it's kind of dark in there, you see all these lectures, you check a box, get up, get your CME certificate, and move on. And this is going to be more of an experience, so I'm excited for it.
Yeah, I agree. Like you said, when we go to these conferences, a lot of the time, you sit down and there's not a lot of network or engagement, and you learn all this really great information. But the question becomes, how do you go back in your clinical practice and utilize that? And so where we can form that integration while they're at the conference, networking, getting to know other people, but also understanding the practical applications of how to treat patients well is really important.
That's very important. Having those clinical pearls to take back to your practice, like you said. And there's so many times you go to conferences and you hear the same thing over and over, the same lectures, the same information, and we need something that's different and exciting.
I love different, and I am very much looking forward to educating. I think we all are. We're educators just by nature, but I'm really looking to harness what you said. It's an experience, and I want the providers to come. I want them to feel renewed when they leave. I want them to feel like they are important, that we appreciate them for what they do, for their patients. And so I think that is as big of a part of DermNexus as the education component of it.
Totally agree. And I want it to be interactive. We have to be interactive. You can't just sit all day and just stare at person after person after person and hoping to pick up something that you can take back with you.
And take a whole bunch of notes that you're not going to look back over.
Yeah, exactly. I really feel like everyone will leave and they're going to be able to say, I've never been to anything like this in my career.
One thing that I would like to say is when I get home from a conference, as I'm sure other people do, you're exhausted. You're just tired and you feel like you need a vacation from the conference you were just at. I want this to be, renewed energy. We talked about that, but I want it to be where we are wanting to go back with a energy of taking care of our patients, and we want to be excited about it.
Yeah, and then when we are excited about it, we do give better care to our patients. So we're energized and we're ready to get back into it. We're not just, it's Monday, you're excited.
Yeah. DermNexus IDIC is taking a multidisciplinary approach to the meeting because I really feel like this is the age of treating the patient holistically. Really kind of gone are the days where you walk in and you're really just treating what you see on the outside. I know that's what I was taught early on. My providers did not even attempt to treat rheumatology or psoriatic arthritis. But I feel like over time that has evolved, and now really the holistic approach is what's better for the patient.
I totally agree. And I had this conversation with one of my patients this week about when I trained, because I've been doing this for over 30 years, when I trained to medicate, fix the problem. But you need to figure out where the problem's coming from. And is there another problem that is linked to this problem that you can possibly fix as well?
Yeah, and you always tell patients that, the skin is an external view of internal disease. And as we've evolved in medicine and understanding immunology, we're seeing the cross-linking of all these diseases together, right? And so if we can treat them holistically from a multidisciplinary approach, well, then the patient's going to do better. The amount of collaboration we have with these other providers in other fields as well is going to be more interlocked, and the patient's just going to do better off in the end.
And the patients actually, they benefit from that. They don't want to go to 100 providers, and they're very impressed that we know a little bit about all of these things. So when you treat a patient as a whole, it really does benefit everybody.
Great. Yeah. You want to minimize the complexity of the disease, right? Diseases are complex in themselves, but if we can minimize the complexity by putting them on a medication that's going to treat multiple parts of the disease, the patient will do better off, because as we know, multi-pharmacy can lead to more adverse events, etc. So we want to make sure that patients do well.
And as we find more about inflammatory diseases, we are finding more comorbidities that all come with it, and that it would be nice if, we could treat the majority of those.
Yeah. So I think when we're talking about an ideal panel for the DermNexus IDIC conference, is including rheumatology, GI, allergy, immunology, and having nutrition there, because we want to be able to see the different vantage points of each of these specialties in relation to our patients and the disease states. And so if we can see how they're treating the patients, and when we refer them to these other specialties, we'll have a better idea of what they're looking at, and just so it's more comprehensive for us. Right?
I love that we're weaving nutrition in there. I feel like nutrition gets left out a lot. So I'm excited about nutrition.
And how cool is it to be able to hear from points of all the specialties in one setting? And instead of having to go to 5 different conferences, different specialties, we're going to get it all in one.
Mm-hmm.
And that's unique. There really are not a lot of other meetings that are using that approach right now.
Yeah, and I think it helps us when we're in the rooms with our patients by hearing maybe questions that they're asking, right, or things they're looking for. We can start asking those questions to put in our progress notes, so when we send it over to these other specialties, some of those questions are being answered.
Right.
So sessions like what your rheumatologist wishes you knew. I run into questions all the time, and I would sure love for them to tell me what I need to be doing.
Right, because our patients will also ask, well, what are they going to do when we go to rheumatology? And so you could set them up and say, well, this is what they normally do when you go. And so, they always want to know. So it's also nice that we're going to hear from them.
And it's sometimes hard to get patients into other specialties. Sometimes there's a wait, so it'd be nice if we could get the ball rolling for them.
Absolutely.
Yeah, especially for patients that may not be able to afford going to many specialties, right? If we have a more comprehensive approach to it, then again, we can help these patients out.
Yeah, I'm in a rural area, and it's maybe a 9-month wait to get into rheumatology. There are 2 within about 4 counties. So that is one reason that I think it's so important for providers in my area to take that holistic approach, because if not, they're going to go without.
Exactly.
Within our group, have y'all thought about the fact that we have over 100 years of clinical practice between us, which is pretty impressive. But what blows my mind is that means that we have over 100 years of conference attendance. Can you imagine how many meetings that we've probably been to over the years?
Thousands.
Yeah. So I feel like we have a good vantage point of, what we feel like we would want to see if we were at a conference. We've experienced all types of meetings over the years. Do you agree? I don't know.
I totally agree. And I would love to have a new twist on learning, which I think is what we're shooting for.
Mm-hmm.
Yeah.
Sprinkled in with a little fun.
Mm-hmm.
There's always got to be fun.
Mm-hmm.
And that's why we invite you to join us at DermNexus IDIC.